Welcome to the workshop, Riding the Emotional Roller Coaster of Survival. My name is Andrea Feldmar, and I will be your moderator for this workshop. I'd like to thank Sobi, whose support helped make this workshop possible. It's my pleasure to introduce today's speakers, Dr. Patricia Fank and Ms. Grace Mooney Melvin. Dr. Fank is an associate professor in supportive oncology with a joint appointment in the Department of Psychiatry and Behavioral Sciences and Internal Medicine at Rush University Medical Center in Chicago. She has specialized in psycho-oncology for the past 12 years, joining Rush in 2020 to focus on the integration of supportive oncology into the bone marrow transplant program. Ms. Mooney Melvin is a licensed clinical social worker with the Rush University Bone Marrow Transplant Team. She provides case management services to patients going through autologous and allogeneic transplant and CAR T-cell therapy. Ms. Mooney Melvin and Dr. Fank, are you there to start the program?
Yes. Right. Hi, everybody. Thank you for joining us today as we discuss the emotional roller coaster of survival. We're thrilled to talk about this topic and discuss the emotional roller coaster that one may experience as a part of survivorship. Survivorship encompasses patients at all points in the transplant process. Survivorship starts on the date of diagnosis and throughout the transplant journey. Along that journey, it is normal to experience emotional distress and psychosocial challenges. So with that said, we hope to focus on these learning objectives. We will identify common psychosocial challenges after transplant and CAR T-cell therapy, distinguish between normal adjustment post-treatment, and determine when to seek outside support, and also to help develop strategies and resources to manage these challenges after both transplant and CAR T-cell therapy. Throughout our presentation today, we will discuss and identify psychosocial challenges that may arise throughout transplant, strategies for adjustment to these challenges, when to seek outside support, and resources that can help when going through this process.
Thank you, Grace, for your introduction. I'm going to start by talking about some of the psychosocial challenges. And as the title of this presentation today suggests, we know that transplant and CAR T can feel a bit like a roller coaster with ups and downs and twists and turns. And we know that for many of you, there really is no aspect of life that has gone untouched. So that's where we're going to start today. It's really taking a look at some, and this list is by no means exhaustive, but it's a start as we try to capture just how winding and impactful this roller coaster can be. For many of you, the roller coaster may mean living with painful and uncomfortable physical symptoms. It might be living with fatigue or mobility issues, living with and getting to know a new body, living with uncertainty, living with graft versus host disease. Maybe it's feeling burnt out from medical symptoms and from illness and side effects. It may be redefining relationships and intimacy, redefining a sense of self or who you are. And all of this and more can leave us living with new and challenging emotions that might be really difficult to cope with. Some of those emotions are listed here on this slide, and similar to the last slide, this is also not exhaustive. The roller coaster leads to many emotional ups and downs. There's no right or wrong way to feel during or after transplant or CAR T therapy. And there will probably be times when you're worried, times when you're scared, times when you want to cry, and that's okay. As Grace said in her introduction, this is all very normal. And sometimes it's really reassuring to hear that these emotions are normal. So we're going to talk more about anxiety and depression both in the next few slides, but I want to highlight a couple of things from this specific slide. The first is that emotions occur on a continuum, and the presence of those, like I mentioned, is very normal. And all survivors experience a wide range of emotions, and not everyone goes through those emotions in the same order, at the same time for the same amount of time, and these emotions, like that roller coaster, can twist and turn. But the important thing to remember is that you're not alone. Your feelings are common and there's support available for you, which we will talk more about. The second thing I really want to highlight on this slide is that feeling of grief that's toward the bottom of this list. And you may be surprised that grief is included here. Many people think of grief as only a reaction to death, but what we actually feel is grief after any type of loss. And that's really important because, as you know, there are many losses that come with a diagnosis of cancer or needing to get a transplant or go through CAR T therapy. Many survivors describe feeling that they lost a sense of who they were as a healthy, well person when they were diagnosed. Others experience grief from loss of hair or the fact that their body may have changed as a result of treatment, or the way that they feel about their bodies may have changed. Sometimes it's the loss of a job, the loss of independence, physical mobility, strength and stamina, the loss of your immune system and your ability to go out and see other people and socialize like you could before. All of these losses can be emotionally painful and cause feelings of grief. Many survivors have gotten so used to coping with lots of change, big or small, that they don't always allow themselves time to deal with the natural feelings of sadness or anger or grief that accompanies those losses. And too often people close to survivors don't really provide themselves time or make time for those emotions either. Friends and caregivers can try really hard to say only positive things or encourage you to think positively, and they may not always recognize. Sometimes there are other tough emotions that are happening as well. However, experts really agree that it's helpful to let out feelings of grief, to share those, experience those, sit with those, process those, so that we can start to enjoy some of the positive feelings or experiences in life again. And so we'll talk more about some of the resources and the tools that you can do toward the end of the talk today. So digging a little deeper into anxiety. Anxiety is a common reaction to both the diagnosis as well as treatment itself, side effects, uncertainty, and the end of treatment too. In its simplest definition, anxiety is a feeling of fear. Fear can be an important for self-preservation because it alerts us to danger. It allows us to get ready to respond. But this anxiety can focus our energy so that our mind and our body and our spirit can react effectively and get us through challenges. Some survivors cope well. They can respond to things as needed, and they know when they need to make decisions. Sometimes, however, anxiety reactions can make it really hard to focus. It can make it hard to relax or to enjoy health after treatment ends. And honestly, researchers don't really know why some of us cope better or in sort of more productive ways than others. The symptoms of anxiety and fear, some of those are listed on the slide. Those can include a rapid heartbeat, shortness of breath, sweaty palms, agitation, sense of panic. Some of those effects can be caused by certain kinds of medical treatments as well. Sometimes medicines that are prescribed can cause feelings of agitation or restlessness that are very similar to anxiety. It's also important to be aware that sometimes when we stop taking medications or substances like nicotine, we can develop those symptoms. And caffeine is one that many of us use, and those can also cause similar restless or increased heart rate, those kinds of symptoms. I want to mention the topic of the fear of relapse disease and cancer recurrence, or fear that cancer might be coming back. It's a really tough to live with feelings of uncertainty, and it's quite common for many people to experience fear and anxiety shortly after ending treatment or ending active treatment and living with survivorship and trying to adjust to what life looks like once treatment is completed. If you're struggling with that, we'll talk about resources and how to utilize your medical team and leverage support that may be available both within your medical institution or in your community. Some survivors also find themselves getting really anxious about annual checkups or tests. They fear that cancer coming back even years after a diagnosis, and it's really understandable. And so again, we will continue to talk about resources. On this next slide is more so about depression. And I often hear people say that they're feeling sad, they're feeling down, or they have the blues. Sometimes this is even made worse by feeling isolated after treatment or while you're immune suppressed. Sometimes it's because other people may not understand what you've been through. Sometimes we feel angry about our situation and about the way that life is now. Chemotherapy and some of the medicines can also cause mood changes. Just like we talked about, they can induce some feelings similar to anxiety. Those mood changes and feelings of depression can get better for some people as you get further away from diagnosis or treatment, but sometimes it doesn't. Sometimes they continue or they go away only to come back again and surprise you. All of these feelings, again, it's on a continuum and it is normal. There is no one right way to feel or to respond emotionally as you go down this journey. There is mental health providers do talk about a diagnosis that's called major depression, and that really involves some of the symptoms you see on the slide: difficulty concentrating, trouble sleeping, loss of appetite, loss of pleasure in activities that you used to enjoy. People with major depression may also have feelings of extreme sadness, guilt, hopelessness. And I think the good news is that there are many effective treatments for this kind of depression, which we'll continue to talk about. So one of the things that I want to highlight right now is this mind-body connection. We've talked about the consequences of illness and how those can impact physical, they can impact social, also emotional. However, we like to separate those from each other. And yet, really what we've learned is that all of these are really interconnected and that these changes and stressors directly impact each other. So I want to highlight this mind-body connection. And we're going to do this with a little experiment today. So I want you all to take a look at the lemon that you see here on your computer or on the slides that you're looking at. And I want you to sit comfortably and just breathe slowly for a few minutes. When you're ready, you can feel free to close your eyes or lower and soften your gaze and just breathe deeply and slowly. And imagine that lemon. Imagine that you're standing in your kitchen or the kitchen of someone that you know. Choose a kitchen that you're very familiar with that's associated with some pleasurable memories. As you see different kitchens that flash through your mind, just settle on one. Imagine that you're standing at the doorway of this kitchen. You may glance around. You see the walls, the cabinets, the countertops, the floors. You see the appliances in this kitchen, the refrigerator, the stove, maybe the dishwasher. You look at the countertops and you notice things that are placed there. Over the sink, there may be a window. Maybe the window's open and there's a soft breeze that's blowing in. There are pleasant smells in this kitchen. It's a really warm and inviting place. And bring your gaze to the counter and notice a beautiful wooden cutting board that's sitting there. And on top of that board is a bright yellow lemon. This lemon from the picture. You notice its color, this vibrant yellow. You notice the shape, the size. And you reach out and you pick up the lemon. You notice how it feels to your touch, how the skin is both smooth but slightly bumpy. Next to the cutting board, you see a sharp knife. So return the lemon back to the cutting board. Carefully pick up the knife in your dominant hand and hold that lemon steady with your other hand and cut that lemon in half. And as you do, you feel the knife slicing through the fruit and it falls open and reveals this beautiful jewel-like pulp in neat rows. You see the fresh white pulp and perhaps some seeds. Drops of juice have spilled onto the cutting board. Now take one half of the lemon and cut it again, making it a quarter-size slice. Put your knife down and bring the lemon quarter up to your nose. You're aware of the sharp, fresh citrus scent filling your nose. Touch the lemon to your lips and notice the sensation. Now open your mouth and bite into the lemon. If you've closed your eyes, feel free to open those and you'll see an image on the slide. And just think about, did you notice any sensation? Did you notice increased saliva in your mouth? Did you start to pucker? Could you maybe even smell a little bit of that citrus? Many people are probably nodding yes or saying yes right now. And really, I want you to just take away how even though there's no lemon in front of us, your mind is powerful enough that it created some physical sensation within your body just through visualization, okay? So just keep that in the back of your mind. We'll continue to reflect on that as we go today. I'm switching gears a little bit to talk about adjustment, because what does all this mean, right? We've talked about how our diagnosis and our treatment, all of this has a huge impact on every aspect of life, how it can create a whole bunch of emotions, how we know that our physical treatments and our body and our mind and our social interactions are all deeply intertwined, and we really can't tease those apart and separate those. So what does that mean for us? What do we do with that information? How do we use this to learn new ways to cope with the challenges that CAR-T and transplant bring? And so that's really the focus of the remainder of this is adjustment, right? And starting to learn or starting to work toward adjusting or adapting or modifying based on our current circumstances and our current situation. Some of the strategies for psychosocial adjustment include a whole host of different things. Now, some of these are going to be talked about in other presentations this week, so I'm not going to delve into all of these. If you want more of that mind-body connection, there's a presentation on meditation you can listen to. There are presentations on eating well, nutrition, on sleep, cognitive functioning, and so much more. So I encourage you to listen to some of those. But there are a few things that we will delve into a little bit more. There is no one fits all in terms of coping, so I'd encourage you to experiment, and if something doesn't seem to work well for you, that's okay. Try a different one or continue asking for help or looking for alternative strategies. Some of the strategies I'll touch on today include exercise, and so really trying to strive for at least 30 minutes, if you can, of active movement. It not only promotes a healthy body, but it's really great for the mind as well. It's a great stress reliever. And we're going to talk a little bit more about stress as we go. Exercise doesn't have to be like training for a marathon. It can simply be walking. It can be just getting up and moving a little bit more. It can also look like running or biking or swimming if you're able to do those things. But if not, maybe it's just moving around the house a little bit more or walking outside. We know that nature is also amazing for our mental health, our emotional health. Nature can decrease anxiety levels, it can lessen stress and feelings of anger. Exercise is better when we're outside. I know not all of us live in areas where we have nice weather year round, but if you're able to get outside, I would encourage you to do so. Regular access to green spaces has been linked to lower risks of depression, improved concentration and attention. So take advantage of those early morning hours or evening hours when the sun's not so bright and get outside when you're able. Hobbies are also really important. New hobbies such as arts and crafts, maybe it's games, gardening, volunteering, participating in clubs if you're able to do things like that. Anything that involves creativity, sensory engagement, self-expression, relaxation, cognitive stimulation are all linked to good mental health and well-being. So again, some of these you may say, nope, that's not for me, or you may not be able to do. But hopefully as we go today, you'll find one or two things that you'll be able to take away that you can try. Some other strategies that can be helpful pertain to things like self-monitoring, which is an umbrella phrase that describes our ability to check in with ourselves, to monitor our emotions, our decision-making. With the ebbs and flows of life, having the ability to check in with ourselves and assess our emotional wellness can really help to improve quality of life. There are also apps that have been designed that can set reminders or send you sort of triggers, kind of notifications to check in with yourself and maybe log how you're feeling or how you're doing. And so some of that is being aware of your limits, observing and recording your behavior. What are you doing? When do you do it? How long and how often? Are there certain times of day where maybe you have more energy or you're able to do a little bit more? Can we pace activities and divide those up with periods of rest so we can accomplish more than maybe if we try to do everything all at once? How do you feel when you're engaging in different activities? Some may produce more feelings of joy or maybe, easier to engage in, and others, again, may not be the right strategy for you, and that's okay. Similarly, prioritizing tasks, breaking things down into smaller steps. There's this thing called completion anxiety where we get anxious about trying to tackle an entire task all at once. So sometimes thinking about having to cook a full meal feels really daunting and feels really overwhelming. But is there a way to break that down? Can I do some veggie prep earlier in the morning? And then, maybe I take those vegetables and I sit at the kitchen table where I can rest while I'm chopping and put it all in a bowl and cover it up and put it in the fridge. And then maybe later in the day, I can grab a few more ingredients and take those to the table and do a little bit more prep and then store it in the fridge. And then maybe in the evening, I just put it together and stick it in the oven, right? And those are all ways that we can sort of break tasks into smaller segments that can feel more manageable and not feel quite so overwhelming. The other thing is focusing on things that we can control. It's very easy to point out and to notice all the things that we used to be able to do that we can't do anymore. And so I'd encourage you to really try to channel your thoughts to what can I still do? Because I guarantee there's more that you can do that you may just be not unaware of or not focusing your attention on. And those are also things that therapy, and we'll talk more about that as we go, but therapists can definitely help with that as well. Managing stress. So it's really helpful to think about life events and all of the situations that we encounter each day, some that were within our control, like maybe it's what time we set our alarm to wake up in the morning, and some that are not. Like, is there an accident on the expressway while we're on our way to work or on our way to an appointment? Stress reactions tend to be unique to each person, and sometimes we cope better than others. One reason could be that we're using different types of coping styles, and there's not one type of coping that's going to work well in every situation. So we really need a toolbox that has a lot of different strategies that we can pull from depending on the situation. I do want to just point out controllable versus uncontrollable. We are a very focused problem-focused driven society. We are trained from a very young age to solve problems. If it's raining, we get an umbrella. If it's cold, we grab a jacket or we turn up the thermostat. We start teaching kids at a young age to do that. We are not very good when problems are out of our control because that requires emotion-focused coping, meaning that we have to process the emotion that stressor brought up because we can't change the situation itself. And for many of you, as you've gone through treatment, through transplant, through CAR T, you can probably identify several uncontrollable stressors that continue to create strong emotions where we need to use more of that emotion-focused coping. As we talk more about stress, I'd like to ask, how many of you have ever lost control of your emotions and you've done something in the heat of the moment that you've later regretted? My guess is most of you, right? Perhaps you've lost it, you've blown up at someone, a partner, a child, a work colleague, perhaps the driver of another car, to a degree that later you realize that probably was uncalled for, a little bit unnecessary. And the answer is yes, for most of us, if not all of us. And to that, I say, you've been hijacked by your amygdala. So this is my little science part of this lecture. So what happens is that whenever there's a stress response or a stressful environment, several areas of the brain work together to send a distress signal that triggers your fight, flight, or freeze response. And I'm sure most of you have heard that before. But those signals happen so quickly in the brain that amygdala is sending those so fast that most of the time we're not even aware. The wiring can be so efficient that amygdala, the hypothalamus can start that cascade before your visual centers even have a chance to process. Like, think about somebody who jumps out of the path of an incoming car without even realizing what they're doing, right? It's because the brain reacts that fast. That stress response often occurs when the demands of the environment are greater than our ability to cope with them. So I want to say that again. So when you have that fight, flight, or freeze response, a lot of times that survival instinct is kicked into gear because your brain has perceived that it does not have the ability to otherwise manage whatever that stressful experience is. It is a survival mechanism. It's evolved in all of us over the years, and it's helpful, right? It saves many of our lives. And yet we know that sometimes our body or our brain is overreacting to things that aren't life-threatening, because that instinct can happen in traffic jams, with work pressure, with health concerns, family difficulties. And it's really hard to put the brakes on those kinds of stressors. And so that becomes more of a chronic stressor, right? A long-term stressor, but it's signaling the same reactions in your brain that those urgent stressors do. So we need to learn techniques to counter that stress response. And the best way to prevent an amygdala hijack is to be more aware of our emotions. So our ability to understand, manage those, check in with those, like I mentioned a little bit earlier. To use that information for positive ways to relieve stress. Another key in amygdala hijacking is recognizing our acute stressors and becoming aware of those triggers so we can make plans for those. We can employ stress management techniques. Employing those techniques can look like breathing, which we'll touch on in a minute, as well as some of those things we mentioned earlier, like exercise or journaling or writing things down. So although we can do some prevention of that amygdala hijack, it takes time. It's not easy. And there are some days where the brain just overrides us, it overrules. And so despite our best efforts at prevention, if you find yourself in the middle of one of those hijacks, there's a number of things that you can do. You can name it. So you can just say, all right, brain, you've currently hijacked me. You can remember the 6-second rule. And this is one that I personally love. Your amygdala is only overruling you for 6 seconds. After that, the rest of your brain catches up and you have the ability to then start to plan how you respond. So you can slow down. You can take some deep breaths. You can turn off that hijack. You can draw on mindfulness and that mind-body connection to calm your nervous system. You can take a time out if you need to. You can step away from whatever it is that's stressing you in the moment. And I know I've mentioned mindfulness already a handful of times. And like I said, there is another presentation on meditation. So I'll just touch on some of this briefly, and then I'll encourage you to listen to that presentation for more information. But mindfulness is really the ability to be fully present, aware of where you are, what you're doing, and not overly reactive. According to a study, mindfulness can help improve emotional intelligence in 3 major ways. It can help you learn how to recognize the emotions, strengthen your ability to control those, and by practicing mindfulness every day, you develop parts of your brain and you make them stronger. There are several techniques that you can use. There's deep breathing. There are box breathing. There's wave breathing. There's triangle breathing. And again, I'd encourage you to look all of these up if you're interested. There are also many different relaxation and meditation techniques, like progressive muscle relaxation, which is systematically attending to the muscles and using imagery to drain tension away. There's scanning your body for stress or tension. There's meditation practices and using the breath to anchor awareness in the present moment. And there's visualization, kind of like what we did earlier with the lemon, where you're using imagery and you're visualizing peaceful and relaxing images. Writing can also be really beneficial for many people. There's a lot of early research into the benefits of expressive writing and found that people who write some of their deepest thoughts and feelings report the fewest symptoms and had the fewest unscheduled visits to their doctors. There's more recent studies and research that show similar benefits in reducing symptoms and improving physical functioning. There's other studies that have shown that even a 20-minute writing session can be enough to change the way that we think and feel about cancer or about our disease. And those effects actually lasted 3 weeks for the folks in that study. So again, there's a lot of research that's been conducted on writing and journaling. There's no one way to write. Just do it. Bullet point. Send yourself a text if you want to. Shoot yourself an email. It can look like anything. Sometimes for many people, it's easier writing than saying things out loud. And so think about, again, what might work best for me. And I also want to touch on this concept. And this is taken, thinking differently, is taken from this concept of cognitive behavioral therapy. And that's a type of therapy that is really popular. It's an effective, research-based, evidence-based form of counseling or psychological treatment. And the key message of cognitive behavioral therapy is that the way we think, so those are our cognitions, and what we do, our behaviors or our actions, can both directly affect the way we feel. So it also follows that if we want to change the way we feel, then we could change the way we think and the way that we act. And so I just wrote a situation up on the slide for you that says, I woke up feeling really fatigued, and I'm sure most of you can identify with this. And we talk about unhelpful thinking because waking up feeling fatigued, that happens for many of us. But sometimes we start to think, I'm fatigued, and then immediately I feel down. I don't have motivation. I may stay in bed because I feel really tired. I withdraw. I socially isolate. I stop eating because maybe I just feel too tired or I've lost my appetite. And we start to make connections, right? With feeling fatigue causes me to feel a certain way. And yet, some people may feel fatigued, but may still have the ability to get out of bed or to push themselves. And why is it that some of us can react differently when fatigue is how we both feel? Well, a lot of times it's the meaning that we attribute. And so this, on the slide, this person attributed, I've been dealing with this for months and it's never going to get better. Right? And those thoughts start to snowball. And so that leads to feeling down. That leads to staying in bed. That leads to withdrawing because that leads to maybe a feeling of hopelessness. And so what cognitive behavior therapy can start to do is it can help us to think about the way we think. And it can say, is there a more helpful way to think about some of these things, to feeling fatigued, right? Because I can think really negatively about feeling fatigued, or I can try to see, is there any other way to think about this? And so maybe we say something like, this is really hard. It's really disappointing, but I've done hard things before. I can do hard things. I'm a strong person. I've been through a lot. I've got a great support team. Maybe I'll have to have them help me a little more today. But if they encourage me, maybe I can at least get out of bed, right? And so again, there's no one way to fit. There's no one way to describe this. It's going to fit for each one of you. This is very much individualized for every person that we work with. But this mind, I tell everyone, is not our friend many times. And it's really, really important that we learn how to recognize when maybe our mind is telling us things that aren't helpful. And so I'd encourage you, if at all this speaks to you or you're interested in learning more, to kind of follow along with some of these next couple of slides that talk about asking for help and asking for support. And I know that can be really hard to do, but it's also so important. So I just put up on this slide a few strategies, a few ways that maybe you talk to yourself to normalize asking for support. I know our society tells us that we should be independent and we should be self-sufficient and we shouldn't rely on other people. And yet we know that life doesn't always work that way. We used to live in villages. We used to Extended families used to stay together in communities. Support was built into everyday life back in the day. And that was beneficial for many reasons. So it is okay to ask for help. It's also okay to set boundaries, right? We sometimes need to teach people how best to help us. And that could look like setting boundaries. It could look like learning how to ask others for help. And so this is a skill that I use frequently and when I'm working with folks individually. And again, I'd encourage you to read through this and take a look and, reach out to a counselor if you want to learn more. And the last piece before I turn this back to Grace is knowing when to seek outside support. And so if you have concerns that are persistent, that don't seem to go away, maybe it's a lack of interest or pleasure, you're feeling really low and not like your usual self, you can't find motivation to do things, even really important tasks, you have trouble sleeping on a regular basis, you have a lot of negative thoughts about yourself or the world or your future, you're unable to control your thoughts or your worries and you're feeling more anxious than usual, or if at any time you have thoughts about wanting life to end or even wanting to harm yourself, those are all times when I would encourage you to reach out, and we'll provide some resources on these next few slides on how you can do that.
And then, so right on the next slide, just in response to what Dr. Fank just said, if you are feeling that point where you're just you're feeling like giving up, or you're starting to have thoughts that are intrusive or a bit confusing, there is the 988 Lifeline, which you can call for support if you are feeling even, suicidal and you need someone to talk to. So keep that as a resource as needed. Then additionally, just as general throughout transplant, don't forget to utilize your transplant team. There are a number of us a part of your team to help you, and that can look different at every cancer center, but it's going to be your doctor, nurses, dietitian, psychologist, social worker. When you have questions, don't hesitate to ask those and ask for support when needed. Often those providers themselves can then connect you to other resources, whether it's physical therapy, counseling, financial resources, occupational therapy. Utilize us to get through this process. In addition, with everything we've been talking about and the emotional roller coaster that is transplant, some people find it very helpful to find someone to talk to outside of the cancer center. A therapist can provide a good outlet for processing emotions and could give you even some of these new tools and strategies for coping during this difficult time. As you can see on the slide, the different ways in order to find a therapist with contacting insurance. If cost is an issue, I encourage you going to your cancer center social worker, see if there's a specific therapist on site or within the community. In addition, actually, BMT InfoNet itself does have its own directory of mental health providers, and you can kind of narrow it down based off of the therapy and people who've gone through transplant. So it's worth considering looking at that as well. And then in addition to that, there are just resources along the lines of support groups, whether it's local or national, disease specific. They're often either virtual or in person. In addition, they provide just overall support for going through what you're dealing with right now. And then we list on the next few slides just a number of those peer support resources so that you can go back to these and kind of take a look at each one that might be helpful. And then so utilize this where I know we're at about time for both resources and then also different apps for mindfulness, as Dr. Fank was talking about before. And then another common thing that comes up as well is sometimes things like wigs, beauty workshops, how we look physically as we go through transplant. So all of these, utilize these resources, kind of reflect back after you look at the presentation. And thank you.
Thank you, Dr. Frank and Ms. Mooney Melvin, for this excellent presentation. We'll now begin the question and answer session. If you have a question for Dr. Frank and Ms. Mooney Melvin, please use the chat box on the left side of your screen to submit your question. We will answer as many questions as possible. And I'm going to start it off with our first question. Why does TBI and chemo cause depression and PTSD in some patients? Why does it affect some patients and not others?
Well, I think that I think this is a really personal and individualized question. Everyone responds very differently, and some of it is genetic, some of it is medications that people are on, some of it is previous, experiences. If somebody else has had other events in their life that may, have already caused depression, or they've had prior traumas. So a lot of it depends on a person's life experiences and what they're bringing to cancer that can change how folks then cope with and manage their cancer diagnosis or treatment. So, I think if you are someone who's coming to treatment with maybe some of those other life experiences, knowing that does increase risk of maybe having a more challenging time coping with treatment, and looking for some of these resources that can maybe help.
Great, thank you. We've got another question. What strategies can I use to help treat prednisone-induced mania?
Well, I think that would definitely be one to talk with your medical team about. Obviously, making sure that they're aware that is a side effect. And then usually we would refer those folks to a psychiatry team so that they can discuss medications that can be utilized to manage those side effects.
Okay, great. So we've got a couple of these. This is a theme that I see going. Can you please talk about the emotional impact of living with having a severely immunocompromised immune system after CAR T? So I think that there are some people that are very nervous about social interactions and how to manage this.
Yeah, we see that often, that concern of feeling isolated, and knowing when it's time to be able to be back out in the world, or when you feel ready. But before that, there are a lot of options. I know we got during COVID pretty used to virtual options, but a lot of the different organizations that are available, like Be the Match, BMT InfoNet, Bone Marrow and Cancer Foundation, all have actually either virtual support groups that at least provide an outlet for kind of what with similar patients with similar experiences. In addition, they even have, for example, Bone Marrow and Cancer Foundation has an app where you can link up with a mentor or someone else that might be kind of experiencing these same concerns, but it gives you another social outlet within your own home. And of course, eventually talking to your doctor and your team about what easing back into the world looks like, and in a safe way, and ways to get involved. And one final thing is, sometimes cancer centers within their surrounding area, there may be foundations, or sometimes they're a center specifically for support groups, counseling for patients going through cancer treatment. They also have virtual classes as well, whether it's a cooking class or yoga. These are other ways to maybe feel involved, but in the safety of your own space.
Yeah, those are some great ideas to sort of seek out some other ways of socializing if you're concerned about the infections. Thank you. Here's an interesting question. Is it common to want to make drastic changes in a survivor way of life? Like just, selling everything and just really living in a minimalist sort of style. So I think is it common to want to make some dramatic changes, I think is the question.
Yeah, well, I think that being diagnosed with something like cancer, right, or having a pretty significant life event can alter our perspective. And so sometimes the things that we used to value, or the things that used to be important to us, once we've gone through something like a cancer diagnosis or a transplant, it may shift, and those things may feel less important. And so maybe, if somebody was, holding on to a lot of things, maybe after going through cancer, they realize, no, I have more value, or I place more value on my relationships or my social engagements, and things and stuff is less important to me. And so it's not uncommon for people to talk about these types of perspective shifts.
Great. Thank you. Yeah. Does the fear of cancer returning ever go away after CAR T cell therapy?
I think the way that I talk about this with many people that I work with is, I think there's a lot of things that go into this. For some people, this fear may be stronger than others. And again, whether or not you have anxiety or things like that, I think all of that, we need to take that into account. But for most people, over time, I talk about it as sort of like, imagine you're holding a sheet of paper that's right in front of your face. And when you're first diagnosed, that paper is up and it's right close to the end, like the tip of your nose. And that's sort of all we can see. And that's all we feel like we can focus on. And then over time, we are able to slowly start to sort of lay that paper down in front of us. And maybe it's sitting on the desk right in front of us, but that's still, we have more perspective, right? We can see other things in life. And over the years, as we get further away and we're staying, we're in good health, maybe that piece of paper gets kind of shifted off to the side of the desk or put under a pile. And it doesn't ever disappear, right? As you have scans or you have other visits, that piece of paper might become more front and center again. But our goal is that over time, we learn to sort of live with, right, or find ways of adapting, like we were talking about, to continue to focus on the positive things or the things that bring us joy in life, so that our sort of perspective isn't only that sheet of paper right in front of us.
Terrific. Thank you. Here's another question. Somebody is taking high dose dexamethasone as part of a treatment plan, and they're wondering, are there any drugs or therapies that can be used to manage personality changes? Apparently, the need to stay on the drug for GVH for the foreseeable future, and the side effects are very difficult to deal with. Any suggestions on that?
Yeah, unfortunately, those high-dose steroids are tough, right? And they can cause a lot of that irritability and kind of short tempers, lack of patience. So I would encourage you to talk with your medical team. I understand that it's necessary for your health and GVHD, and see if there's a psychiatrist within your institution, within your medical team that you could talk with about additional medications that maybe can help manage some of those unfortunate side effects that come along with the steroids.
Mm-hmm. Yeah. So can you speak to any way that somebody can really prepare for a stem cell transplant sort of psychologically?
I think every transplant center does that a little bit differently. I would definitely encourage anyone that's considering a stem cell transplant or discussing with their medical team the option of transplant to reach out and find, to learn what support resources exist, both within my institution, my medical institution, but also within my community. I think it's really helpful to meet with the team, to talk about what this might look like, to try to wrap our mind around it as much as possible, to understand what life might look like after a transplant, to meet, if possible, and talk with other patients that have gone through something like this, and kind of get their perspectives or tips or tricks from them. But just know that there are counselors, there are social workers out there that are happy to help you process and learn and kind of come to terms with what this might mean for life for you.
Okay, thank you. And I think we've got time for one last question. And just for clarity, do you see any difference between stem cell transplant versus CAR T emotionally? Do you see any difference on those fronts? And this will be our last question.
Yeah, honestly, I think it's not so much about differences between types of treatment or even types of disease. it's just individual differences, again, in how each of us were bringing with us our life history and our prior experiences. And so we bring all of that into whatever the new stressor is. And so honestly, a lot of these emotions we could apply this to a whole host of different situations. Again, it's more so just individually kind of how we ourselves react and respond and what we're bringing with us into that new stressor.
Terrific. Thank you so much. On behalf of BMT InfoNet and our partners, I'd like to thank Dr. Fank and Ms. Mooney Melvin for a really helpful presentation. And thank you, the audience, for your excellent questions. Please contact BMT InfoNet if we can help you in any way. Enjoy the rest of your symposium.